Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We have a lot of topics today because the Trump White House and their little toadies are really attacking healthcare, and we're going to address some of that. But before we do, let me tell you that down below in the YouTube description box, you'll find a link for the Healthcare Advocacy newsletter. That is the text for this video. All of the actions that we talk about and news stories and medical references and published journal articles, they're all in there. And there's a whole host of resources down at the bottom of every newsletter related to healthcare, related to healthcare advocacy, related to trying to get universal healthcare and better reproductive rights, whole host of things. You can go there and, of course, subscribe for free because we can't take money for any of this. Okay, so let's get started. Trump screws up prescription drugs. This last week, Trump said he plans to impose tariffs of 25% on pharmaceuticals shipped to the United States starting April 2nd. He recently enacted a 10% across-the-board tariff on goods coming from China and a 25% tariff on all drugs, and he plans to increase the tariffs even more. It'll go substantially higher over the course of a year, he said, but he added he wants to give industry a time to bring their factories home to America to avoid the tariffs. This is editorial. Estelle bullshit. Anyway, as for the pharmaceutical industry, how big is it? Well, the U.S. purchased $176 billion of drugs and related goods in 2023, according to U.S. trade data. There's a link to that in the newsletter, making it the largest importer of pharmaceutical products that year. European, Indian, and Chinese firms could be hardest hit by all this garbage. In 2023, Ireland accounted for 20.4% of pharmaceutical imports, followed by about 11%, 10.8% from Germany, 8.6% from Switzerland, 6.2% from India, and 3.4% from China. Action. Tell your member of Congress and senators and the White House we pay more for health care than anyone, and now they want to increase the cost of prescriptions. You can call them. The link is in the newsletter down at the bottom in the resource section, or use my favorite way, use ResistBot on your cell phone. Send a text message, sign, S-I-G-N, space, PCWCUC, sign, PCWCUC to 50409, and here's what you'll be sending to all of them. Prices are rising like crazy in this new administration, and now I see the government wants to put additional tariffs on prescription drugs coming to the U.S. 80% of common medications used in the U.S. are made overseas. These tariffs will hurt all of us. You were elected to govern and help your constituents, not punish them by making them pay more. I strongly urge you not to punish patients like this. Okay, let's talk about pro-life, just not the woman's life. Pregnancy became far more dangerous in Texas after the state banned abortions in 2021. ProPublica, the news research group, found this out in a first-of-its-kind data analysis, and there is a link to that in the newsletter. The rate of sepsis, that's blood poisoning, shot up more than 50% for women hospitalized when they lost their pregnancies in the second trimester, ProPublica found. The surge in this life-threatening condition caused by infection was most pronounced for patients whose fetus may still have had a heartbeat when they arrived at the hospital. The standard of care for miscarrying patients in the second trimester is to empty the uterus. This is according to leading medical organizations, which can lower the risk of contracting the infection and developing sepsis. If a patient's water breaks or her cervix opens, that risk rises with every passing hour. And I'm telling you, this stuff goes super fast. It's not like you have days to wait. Hours and especially minutes matter. Anyway, sepsis can lead to permanent kidney failure, brain damage, and dangerous blood clotting. Let's put that at deadly blood clotting. Nationally, it is one of the leading causes of deaths in hospitals. Now, while some Texas doctors have told ProPublica they regularly offer to empty the uterus in these cases, other doctors were, I think, a little more honest. And what they said is their hospitals don't allow them to do that until the fetal heartbeat stops, so they can they can then document a life-threatening complication, because otherwise the woman's life doesn't matter. So what happens when you delay? Well, forced to wait 40 hours as her dying fetus pressed against her cervix, Josele Barnica risked dangerous infections. Doctors didn't induce labor until the fetus no longer had a heartbeat. They did not empty the uterus. Physicians waited too, as Nevaeh Crane's organs failed, before rushing the pregnant teenager to the operating room. They had to waste time running an extra test to make sure the fetus heartbeat stopped. What happened? Both women were very looking forward to having children and were hoping to carry the pregnancies to term. And both of them suffered miscarriages, and guess what? They're dead, both of them. States that ban abortion are just not safe for women. Trump and Republicans to the poor. Screw you. 9 states have expanded Medicaid to cover those with incomes up to 1.38 times the federal poverty limit. They're going to stop that expansion if federal Medicaid budgets decrease. That puts 3 million of us at risk of losing health care. If the Medicaid cuts are significant, then another 18 million of us risk losing health insurance because states won't be able to make up the difference on their own. Trump promised no cuts to Medicaid. Well, that was bullshit. Now he supports the Republican budget, which is coming up for a vote Tuesday, February 25th in the House of Representatives. The proposal would also cut, get this, $230 billion from food stamps. Remember, 42 million of us need nutrition assistance, and another 5 million seniors go hungry but are eligible, but they're too ashamed to ask for help. All of this to pay for a $4.5 trillion tax giveaway that mainly benefits billionaires and big corporations, who, by the way, don't need it. Action. Let's reach out to our member of Congress and tell them we say hell no. No cuts to Medicaid, no cuts to food stamps. I have some references in the newsletter. There's a Medicaid call script from 5 Calls. There's a Medicaid email tool from Families USA. There's an email tool to let your representatives not to cut SNAP. I have a reference down in the resource section of the YouTube description box. You can use that, or my favorite, use ResistBot. You can just send a text message, sign SIGN space PXEXEJ, sign PXEXEJ to 50409. Here's the message, which, by the way, if you want to call, you could use it as a template call script. I'm your constituent, and I'm appalled that Republicans want to cut Medicaid and nutrition assistance. How heartless can they be? 3 million of us will lose health care in the 9 states with Medicaid expansion trigger laws, and another 18 million at risk in states who cannot afford to make up the difference. By the way, 42 million of us need assistance to get enough food to eat every month. I strongly urge you to stop these attacks on low-income Americans. Do not put through the tax cuts on the backs of the poor. Now, it's really important. Do this anytime, but it's important to do it before Tuesday, February 25th. Make sure you try and do it by Monday night, because Tuesday, this is coming up for a vote. The budget reconciliation is coming up for a vote Tuesday, February 25th. Now, another action you can take, February 28th is the National Day of Blackout Protest. Do your best to buy nothing. If you have to buy something essential, do so in a local store. Try not to go to a chain store, because we want the economic impact to be felt nationwide, and the big stores will feel it. Okay, look, I know we give you a lot of actions. Whatever action you can and you choose to take is great, but please take action. We've got to push back. Thanks. That's what I've got for you today. Down below, you can like, share, and subscribe. Go to the Healthcare Advocacy newsletter. You can subscribe, get it in your inbox every day for free. Send me comments here or at healthcareadvocacy1@gmail.com. Have a good day.